Hey everybody, today I want to talk about omega-3 fats. We don't really push a whole lot of supplements part of Simply for Life because our core philosophy is to get your nutrients from food source and always. But the overall impact on the epidemic, on cardiovascular disease, depression, anxiety, so forth, so on, I think that I need to better explain why we formulate this omega-3 fats and why I've done it in a selfish way because it was mostly for me. Omega-3 fats we know has proven the test of time with over 40 years of scientific evidence and research. We have more and more deficiency in omega-3 fats. It's not a scare tactic. It's happening right now. We have too much omega-6 and not enough omega-3s. And what you need to know about really good quality omega-3 fats with the right APA and DHA, these are the long fatty acids, is that it has the ability to help with depression, anxiety, rheumatoid arthritis. It's good for your metabolic rate. It's good for inflammation. There's a slew of things that's actually very beneficial for you. But why I've designed this, and it's a direct replica, our omega-3 fats at Simply for Life, not only it's the purity, but it's a direct replica. If you go and Google the Lyon Heart Study on the benefits of the Mediterranean diet, what was the right ratio of EPA and DHA? And I've spent over 25 years now researching the Mediterranean diet. I spent a great amount of my time on the island of Crete, where it's the stellar region of the Mediterranean diet. Matter of fact, I'm there in a couple months again to visit some of my friends, the farmers, the cultures. They live to have a very long, happy quality of life, and they have very low incidence of cardiovascular disease. So having cardiovascular disease, I want to make sure that I formulate something that was selfish for me, but with benefits, because the omega-3 fats I formulated, and I've worked with key researchers in this field. It's good for your triglyceride. It blunts your triglyceride, and we know triglyceride is a driver for cardiovascular disease. And it can blunt your triglycerides from 15 to 30% significantly. There's not a medication that can do this right now. It's good for your blood vessels. It helps dilate your blood vessels. It's better for nitric oxide production. It's good for your HDL. It helps increase slightly your HDL. It also, and I think that's one part that the medical establishment, and it's really changing right now, but they're not checking enough. They're not looking at the particle size. So it helps have a better particle size ratio, a fluffy LDL cholesterol that everybody talks about. That's really great for cardiovascular disease. Why I've designed the right ratio on APA is because it helps prevent blood clot as an antiplatelet. It's absolutely fantastic for that. It's exceptionally good for if you have plaque, if you already have 40, 60, or 70% plaque, or if you do a calcium score and your calcium score is quite high, you have angina. It's good to reduce symptoms of angina also. And the main important thing why I've designed this to a replica of the Mediterranean diet, it's simply because we know most disease now are caused by some sort of inflammation. And cardiovascular disease, it's no longer argued anymore. We know that inflammation is one of the key driver. So not only that, it reduces inflammation. And for me, it's far more important than the markers of cholesterol that now that science are kind of shifting in a different avenue because inflammation is key. Because when you control inflammation, you're not just reducing inflammation for your heart, it's for your whole body. The beauty about this, you can crunch them, because I used to hate the rancid or the fishy taste of it. You can crunch them if you want to, and you'll see you're really not going to have an aftertaste. Better than that, the purity of our products is above and beyond, and you're getting exactly what we say it's in the bottle. Now, yes, you can go with food, and I eat my sockeye salmon and walnuts pretty much on a regular basis. But the reality is that I need something that I can totally trust and depend on to reduce my risk. And omega-3 fats is one of those that even before Simply for Life, I was a long time fan of. But the reality, there was poor products, and some of them, they have so many marketing claims that my head was spinning. So I've designed this omega-3 fats truly selfish. It was designed for me because I want to live longer, better, and have a good quality of life. So I'm just very excited, and it's now available in all our clinics. The price is absolutely fair on this, and it comes in 120 capsules per unit, so you get about a 6 to 8 week supplies. Thanks for listening. I value your time, and have a fantastic day.